guys, Jim here. Welcome back to our Pediatric Echocardiography Registry review. Let's keep rocking this test. Question 101. This type of surgery was performed to correct which of the following? A. Detransposition of the great arteries. B. Total anomalous pulmonary venous return. C. Chortria triatum. Or D. Hypoplastic left heart syndrome. This is a patient who underwent a Senning procedure to correct their detransposition of the great arteries. Question 102. Drag and drop the letter X on the left common carotid artery in this patient with a type A interrupted aortic arch. So where would you drop this X on your image? The answer is right here. So this region here is the left common carotid artery. Question 103. Which of the following is correct for a Musser procedure to repair detransposition of the great arteries? A. Redirects deoxygenated blood flow from the SVC to the right atrium through the tricuspid valve into the right ventricle and then to the lungs. B. Redirects deoxygenated blood flow from the SVC to the left atrium through the mitral valve into the left ventricle and then to the lungs. C. Redirects oxygenated blood flow from the lungs to the right atrium through the tricuspid valve into the right ventricle and then to the body. Or is it D. Redirects oxygenated blood flow from the lungs to the left atrium through the mitral valve into the left ventricle and then to the rest of the body? The answer is B. Redirects deoxygenated blood flow from the SVC to the left atrium through the mitral valve into the left ventricle and then to the lungs. Question 104. What is the arrow pointing to? A. SVC septal defect. B. Primum ASD. C. Ostium secundum ASD. Or D. Secundum ASD. This view represents a bicaval view using TEE, or transesophageal echocardiography. Over here we have the SVC, and the IVC is not shown, but it would be over here. This is a superior vena cava septal defect. Question 105. Click on the Rastelli patch. The answer is right in this region here. A Rastelli will close off a VSD. Question 106. What is the arrow pointing to? A. Ostium secundum ASD. B. Septum primum ASD. C. Superior vena cava septal defect. Or is it D. septum secundum ASD. Again, this is another image of the bicable view with the superior vena cava over here. And this is a superior vena cava septal defect. Question 107. The Rashkind procedure is used for which of the following? A. Detransposition of the great arteries. B. Tetralogy of flow. C. Double inlet left ventricle. Or D. Interrupted aortic arch. The answer is A. Detransposition of the great arteries. Question 108. What does this echocardiogram demonstrate? A. Interrupted aortic arch. B. Truncus arteriosus. C. Double outlet right ventricle. Or D. Tetralogy of flow. The answer is C. Double outlet right ventricle. Question 109. What is the benefit of the peak TR jet? A. Evaluates RV compliance. B. Evaluates pulmonary hypertension. C. Evaluates RA pressure. Or is it D. Evaluates central venous pressure? The answer is B. Evaluates pulmonary hypertension. Question 110. This type of surgery was performed to correct which of the following? A. Total anomalous pulmonary venous return. B. Pulmonary atresia within an intact ventricular septum. C. Dextrotransposition of the great arteries. Or D. Hypoplastic left heart syndrome. This is a patient who has a mustard procedure to correct their dextrotransposition of the great arteries. Question 111. What does this image demonstrate? A. Coarctation. B. Right aortic arch. C. Double aortic arch. or D, interrupted aortic arch? The answer is D, interrupted aortic arch. Question 112. What does this image demonstrate? A, coarctation, B, left aortic arch, C, double aortic arch, or D, interrupted aortic arch? The answer is D, interrupted aortic arch. Question 113. What does this image demonstrate? A, double aortic arch, B, right aortic arch, C, interrupted aortic arch, or D, coarctation? The answer is C, interrupted aortic arch. So I'm showing you the same image defect over and over on purpose so that you will know and identify this type of disease on your boards. Question 114. Click on the pulmonary artery in this patient with detransposition of the great arteries. The answer is right here. This is the pulmonary artery. This is the left ventricle, right ventricle, aorta. Question 115. Which of the following is associated with an overriding aorta? A, double inlet left ventricle, B, atrioventricular septal defect, C, interrupted aortic arch, or is it D, pulmonary atresia with an intact ventricular septum? First off, notice how I left out tetralogy of flow conveniently for this question? Well, they're going to expect you to know that for an overriding aorta. Make sure you know every disease that is associated with the overriding aorta. This includes, of course, tetralogy of flow, the answer to this question, interrupted aortic arch, and also double outlet right ventricle. Question 116. Based on the severity of this tricuspid regurgitation, what can be expected for the severity of mitral stenosis? A, mild, B, moderate, C, severe, or D, unable to determine with TR jet alone? make sure you look at the entire image. For instance, the velocity is 4.2 meters per second. That's important to know. The answer is C, severe mitral stenosis. This is because blood flow will back up into the lungs and into the right side. This will cause pressure and volume to build up in the right ventricle, causing this tricuspid regurgitation. Question 117. Which of the following is associated with an absent pulmonary valve? A, tetralogy of flow. B, double outlet right ventricle. C, pulmonary artery sling. Or D, interrupted aortic arch. The answer is A, tetralogy of flow. Question 118. Based on the severity of this mitral valve stenosis, what can be expected for the severity of pulmonic regurgitation? A, mild, B, moderate, C, severe, or D, unable to determine with MS severity alone? The mean gradient is 18 millimeters of mercury. That should be a big clue. The answer is C, severe. And just like before, this will cause pressure and volume to build up in the left atrium, causing blood flow to back up into the lungs, then causing pressure and volume to build up in the pulmonary artery and the right ventricle. This will cause an increase in severity of your pulmonary regurgitation. Question 119. What is the primum ASD associated with? A, partial anomalous pulmonary venous return. B, persistent left superior vena cava. C, sinus venosus defect. Or D, cleft mitral valve. The answer is D, cleft mitral valve. Now let's say that this question asked, which is associated with a superior vena cava septal defect? Which of these options would be correct? And the answer to that question is partial anomalous pulmonary venous return. So you'd answer that. But for this question, what is a primum ASD associated with? That would be a cleft mitral valve. Question 120. Which of the following describes this mitral Doppler? A, normal mitral valve. B, mild mitral valve stenosis. C, moderate mitral valve stenosis. Or D, severe mitral valve stenosis. When you're grading the severity of mitral stenosis, the number you want to pay attention to is the mean peak gradient. This one is 15 millimeters of mercury, which is associated with severe mitral valve stenosis. Anything above a mean gradient of 10 millimeters of mercury is severe. You can say mean gradient or you can say mean peak gradient. Question 121. What is an ostium secundum associated with? A. Total anomalous pulmonary venous return. B. Mitral valve prolapse. C. Atrioventricular septal defect. Or D. Partial anomalous pulmonary venous return. The answer is B. Mitral valve prolapse. Question 122. What does this image represent? A. Double outlet right ventricle. B. Tetralogy of flow. C. Interrupted aortic arch. Or D. Truncus arteriosus. The answer is A. Double outlet right ventricle. This is the aorta, and the pulmonary artery is right over here. Notice the overriding aorta. Question 123. What's the surgical process to surgically correct hypoplastic left heart with the Norwood? A. Neo-aorta, Fontan, then Glenn. B. Fontan, then neo-aorta, then Glenn. C. Glenn, then Fontan, then neo-aorta. Or is it D. Neo-aorta, Glenn, then Fontan? The answer is D. Neo-aorta, Glenn, then Fontan. This is the first stage, the neo-aorta. Second stage is the Glenn. And the third stage is Fontan. Also, in the second stage, you'll have a BT shunt. Now, the way they phrase this on your boards is really confusing because they will almost classify the Norwood as a separate step. So if you're asked to put these in order and they put Norwood as one of the options, along with neo-aorta, Glenn, and Fontan, then of course you're going to put Norwood first, then neo-aorta, then Glenn, then Fontan. I know it's weird, but that would be the correct answer based on how they wrote the question. Question 124. Which describes how SVC color and spectral Doppler characteristics would look like on the screen? A. Blue colored Doppler with spectral waveforms above the baseline. B. Red colored Doppler with spectral waveforms below the baseline. C. Blue colored Doppler with spectral waveforms below the baseline. Or is it D. Red colored Doppler with spectral waveforms above the baseline? The answer is C. Blue colored Doppler with spectral waveforms below the baseline. Click on the aortic valve in this patient with detransposition of the great arteries. The answer is right here. This is the aortic valve, and this is the pulmonic valve. Question 126. What does this image represent? A, interrupted aortic arch, B, coarctation, C, right aortic arch, or D, left aortic arch? The answer is B, coarctation. Question 127. What does this image represent? A, double outlet right ventricle, B, tetralogy of flow, C, interrupted aortic arch, or D, truncus arteriosus? The answer is C, interrupted aortic arch. And a way you can tell that this is interrupted aortic arch and not double outlet right ventricle or tetralogy of flow is look at the aorta. This is hypoplastic, which is common with interrupted aortic arch. Little clue for you. Question 128. What's the surgical process to surgically correct hypoplastic left heart? A, neo aorta, then Fontan, then Glenn, then Norwood. B, Fontan, then neo aorta, then Norwood, then Glenn. C, Glenn, Norwood, then Fontan, then neo aorta. Or is it D, Norwood, then neo aorta, Glenn, then Fontan? And remember, we talked about this earlier. The answer is D, Norwood, then neo aorta, then Glenn, then Fontan. Now, obviously, when you study the Norwood, this includes the neo aorta, which is the first stage, then the Glenn, which is the second stage, and BT shunt, then the Fontan, which is the final stage. Keep in mind that your boards might throw in Norwood as a separate step from neo aorta, Glenn, and Fontan. And if that's the case, just put them in order just like this, and you'll be just fine. Question 129. Where does the azygous vein drain into? A, IVC, B, SVC, C, right atrium, or D, coronary sinus? The answer is B, SVC, or the superior vena cava. Question 130. Which is a ductal-dependent lesion? A, detransposition of the great arteries, B, L-transposition of the great arteries, C, double outlet right ventricle, or D, tetralogy of flow? The answer is A, detransposition of the great arteries. Other diseases that are ductal dependent include interrupted aortic arch, aortic atresia, pulmonary atresia with an intact ventricular septum, and hypoplastic left heart syndrome, just to name a few. Question 131. Click on the pulmonic valve in this patient with double outlet right ventricle. The answer is right here. This is the pulmonic valve. But what if this question was asking, click on the pulmonic valve in this patient with detransposition of the great arteries? Where would the pulmonic valve be in that scenario? If this was DTGA or dextrotransposition of the great arteries, then your pulmonic valve would be right here, and this would be your aorta. Now, not to confuse you, this is a patient with double outlet right ventricle. I'm just trying to show you different scenarios with the same image with a different question so that you will know the anatomy for certain diseases. So for double outlet right ventricle, this is the pulmonary valve, and this is the aortic valve. Question 132. How do you determine severe pulmonic regurgitation with spectral waveforms? A, mid-systolic pulmonary valve closure. B, prolonged diastolic flow. C, early termination of diastolic flow. Or D, absent A wave and mid-pulmonary notching. The answer is C, early termination of diastolic flow. Question 133. Which is a sign of severe tricuspid regurgitation? A, systolic flow reversal in the hepatic vein. B, systolic flow reversal in the pulmonary vein. C, retrograde diastolic pulmonary artery flow. Or is it D, early systolic termination of the TR jet? The answer is A, systolic flow reversal in the hepatic vein. Question 134. Which of the following represents severe aortic regurgitation? A, pressure half time greater than 1500 milliseconds. B, retrograde holodiastolic abdominal flow. C, antegrade systolic flow in the aortic arch. Or D, late closure of the mitral valve. The answer is B, retrograde holodiastolic abdominal flow. On your boards, they might say retrograde diastolic abdominal flow instead of retrograde holodiastolic abdominal flow. Either way, they're both the correct answer. So if it's just diastolic abdominal flow, choose that one. Question 135. Which of the following causes pulmonary vein reversal? A, severe aortic stenosis. B, severe aortic regurgitation. C, severe tricuspid regurgitation. Or D, severe mitral regurgitation. The answer is D, severe mitral regurgitation. Question 136. Which is associated with this echocardiogram? A, Noonan syndrome. B, cat-eye syndrome. C, Down syndrome. Or D, Williams syndrome. This patient has a complete AVSD or an endocardial Cushing defect, and this is associated with patients with Down syndrome. Question 137. What will happen to blood flow through the tricuspid valve during inspiration in a patient with constrictive pericarditis? A, increase, B, decrease, C, unaffected, or D, completely stops? The answer is A, increase. Question 138. What will happen to blood flow through the mitral valve during inspiration in a patient with constrictive pericarditis? A, increase, B, decrease, C, unaffected, or D, completely stops? The answer is B, decrease. Now, this question said, what will happen to blood flow through the mitral valve during expiration in a patient with constrictive pericarditis? And the answer would be increase. Patients with constrictive pericarditis, when they breathe in or during inspiration, blood flow will increase through the tricuspid valve and decrease through the mitral valve. Then during expiration, blood flow will decrease through the tricuspid valve and increase through the mitral valve. And that concludes all the questions for this video. I will hurry and write 25 more questions and upload that video as fast as I can. If any of you have any questions about your upcoming pediatric echo boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can personally text or call at 435-922-1635. If you're looking to purchase mock exams for your upcoming pediatric echo boards, go to my website, ultrasoundboardreview.com, and you can purchase our mock exams from there. Also, if you're looking for further study material, you can purchase my Pediatric Echo Workbook. This will help you study, prepare, and pass your upcoming RDCS and or your RCCS. With my workbook and mock exams, you are 100% guaranteed to pass your upcoming pediatric echo boards. I'm Jim with ultrasoundboardreview.com. We'll see you next time.